divided into multiple parts, namely three. That is parts A and B, that's original Medicare. Part C, which is Medicare Advantage. And Part D, which is your prescription drug coverage. So this presentation is only going to take 2 hours, so just sit back and relax. Everything's going to be fine. Nobody laughed at that. Y'all know good well it's not going to take 2 hours, right? This might be 37 minutes at the most, okay? Relax, I'm trying to warm you up a little bit. Okay, so original Medicare, and this is what's offered by the federal government. You have Part A. So original Medicare offered by the federal government, you have Part A, and that covers hospital, skilled nursing facilities, hospice, and home health. You also have Part B, which helps cover doctor appointments, outpatient care, occupational and physical therapies. So next we're going to talk about Part C, which helps cover everything that Medicare Parts A and B cover. Often covers additional services like dental, vision, and wellness programs. Part D covers prescription drugs. So your Medicare options, we're going to talk about that a little bit. So you have original Medicare. And can everybody see this okay?
Yes.
So that's Part A and B. So Medicare supplements are insurance from a private company. So Part A and B doesn't mean that you won't pay anything. So there's going to be some gaps here and there. So this Medicare supplement would be there to cover the gaps as far as co-payments and co-insurance. Part D is your standalone prescription drug plan, and this also is from a private company. So Medicare Advantage from an insurance company, which includes Part A and B, includes these plans. They often have, includes prescription drug coverage as part of the plan, and often you have the Part B premium in addition to the Medicare Advantage plan. So you'll find that there's not a one-size-fits-all for Medicare or the prescription drug plans or Medicare Advantage or the Medicare supplements. It's all dependent upon the individual and your individual situation. So with original Medicare, you'll pay the share of costs. Now, as you look at this here, the cost of healthcare retirement is concerning. Is anybody concerned about the healthcare retirement and anything about healthcare going up? I am, and I'm not ready for Medicare yet. It's a few years off. So it's $3.8 trillion in national spending back in 2019. And it's expected to go up 5.4% by 2028. Okay? So that's concerning to a lot of people, and certainly for me. And you may be concerned about running out of money and that type of thing too. Here's the other thing I want to talk to you about. Obviously, seniors spend more on healthcare. As we know, when we age, we actually have other ailments that starts to creep up. I tell people, I used to play football and I ran track in high school and college. I know y'all don't believe that, and that's not a joke, that's for real. I ran hurdles in college. Anyway, so seniors spend more on healthcare. That's the only thing I want you to get from this. So all ages spend about 8.2%. Seniors, 65 and older, spend about 13.6% on healthcare. So I'm gonna go over a quick definition. You don't have to read all this. I'm just gonna read one little part for this so you understand what IRMA and MAGI is, okay? Has anyone ever heard of IRMA and MAGI? Okay, so let's talk about IRMA. So IRMA stands for the Income-Related Monthly Adjustment Amount. It is an extra charge added to your Medicare Part B and D premiums. So if your income exceeds a certain threshold, which I'll show you in a minute, then IRMA will come into effect. So the purpose of IRMA is to ensure that individuals with higher incomes contribute more to the cost of their Medicare coverage. Now let's talk about MAGI, M-A-G-I. So MAGI stands for the Modified Adjusted Gross Income. It's a measure of income that's used to determine the eligibility for various tax and financial benefits, including Medicare IRMA, which we just mentioned. And that's all I want you to know about that right now. So now what I want to show you here is the income ranges. So if it's, so at $106,000 for an individual or $212,000, the Part B IRMA surcharge is 0, so there is no IRMA surcharge. Part B total monthly premiums $185, and there's no Part D IRMA surcharge. As you see, as the income goes up, the amount changes for the Part D IRMA surcharge and the total Part D premium.
Are you saying, I'm sorry, can I ask a question?
Sure.
Are you able to go back, yeah. Okay, so that first, slide of income there,
Mm-hmm. This one here?
yeah.
Yes.
Part B, is that where it says, yeah, right there,
Yes. 185?
yeah.
Mm-hmm.
Is that the premiums that you pay?
That's how much you have to pay?
That's the,
That's
yes,
the amount
that's
that you
the,
pay.
correct. That's the amount that you pay. I know. So is anybody else shocked that when you get to a certain age and you're taking Medicare that you actually have to pay for something, right? And to be honest, I was too. Before I started this, I assumed that that Social Security wasn't taxed, and I was also assumed that Medicare was free, that we'd already earned it through all this work and the stuff that we've done. But not quite the case. Not quite the case.
So where did they take that money out from?
So, that's a good question. It's potentially taken out from Social Security. And that's what a lot of people do, as opposed to paying that every month. Good question.
One more question.
Oh, yes,
If we
yes.
go back to the, now, 106,000 a year,
Mm-hmm.
is that an individual?
Yes.
Individual.
So yes, ma'am. So right here we have income range individual 106 or less. This is where you are.
Okay.
More than 106, and this is joint income being 212,000.
Okay,
Mhm.
okay, since we're married, our income will be 212,000 to be in that 185 a month premium.
Correct. Correct.
Okay.
Correct. And by the way, let me just pause here just for a moment. Now I know that there's a lot that I'm gonna say here, and I don't expect you to get all of it, but I wanna make sure that I've hopefully enlightened you a little bit more on Medicare, the supplements, and Medicare Advantage. So at the end, I'm gonna, actually my lovely wife here, Kim, wave your hand, Kim. She is going to hand out a permission to contact, and on that permission to contact form, it has a list of things that we can discuss if you have further questions, and we can go in depth with them, okay? And the reason why it's not that I don't like answering questions, I actually like it, but the problem is you all have individual, unique circumstances, and to do your question justice, I would really need to sit down with you and then go through all your stuff, meds, doctors, things you want, things you don't want, those type of things. Yes, ma'am.
Okay, my husband's been on disability Medicare since 2014. Now, I'm gonna be getting Medicare starting in June.
Mhm.
He doesn't pay anything.
Mhm.
Is that gonna change for him?
No.
No?
No. That shouldn't change for him at all. So see, it's a good example. So I only know this because I was kind of hearing you talk a little bit. So sometimes you can have something that's called dual coverage, and you can have something that's special needs. Okay, with dual coverage and special needs, you have a little bit more benefit, and a lot of these costs go away. Okay. All right. Back to the presentation. Seems like y'all got a little heavy on this one. Y'all okay? Everybody all right? Okay, I know it's a premium. I know you're thinking about that premium. I get it. Trust me. Oh gosh, I
I
get
still
it.
got questions.
So with Medicare, so Part A and Part B. So premium, Part A, $285 a month, deductible of $1,676. Part B, $185 a month, deductible $257 a year. And these are the surcharges here, which I just went over on the previous slide, just to drive it home. All right, now I know this is blurry, so I'm gonna try and read this to you as best as I can. I'm working on these slides. I'll have a better one soon. So Medicare Part A costs, let's look at it. So your monthly premium with a Part A deductible here, with this is gonna be that actually should be $16.76 for the benefit period. Most people pay Medicare taxes while working, okay? And then this is what it covers. Again, remember Part A is gonna be your hospital benefit. So it covers up to 60 days. 60 days, you don't pay anything, okay? 61 through 90, you're paying $419 a day. 91 to 150, $838 a day. And after 150 days, it's 100%. Now, if it's skilled nursing copays, and by the way, let me go back. From my years in the hospital, you more than likely will not stay up to 60 days unless you're on a ventilator and very, very, very sick, okay? Usually, we're trying to get you out, not say we, but the hospital is trying to get you out of there to another level of care. Of course, not sooner than you need to, but they actually have a specific time that they would like to move you along. So if you're in a hospital and they have you in observation, anybody been in a hospital and had observation? Okay, so observation does not count towards your stay, right? Because you're not admitted to the hospital, okay? So if you're gonna stay greater than 3 days, you want to make sure that that it's actually gonna be covered by Medicare. Observation is under something else, okay? So day 1 to day 20 in the skilled nursing facility, there's no copay. So sometimes when you're in the hospital and you're transitioning, you're not sick enough to be in the hospital, but you're not strong enough to be home, they're gonna send you to what is called rehab. Now rehab, which is in a nursing home or skilled nursing facility, we don't call them homes no more, but skilled nursing facility, it's day 1 to day 20. They're gonna be trying to do their best to try and get you strong enough to move out and transition to home, okay? Day 21 to 100, you'll be paying $209.50 a day. Day after 100 days, 100%. Part B costs in 2025, let's look at that. So this is gonna be $185 to $628.90. Remember I said that there's some difference because of IRMA and your MAGI, modified adjusted gross income. And then Part B deductible is $257 a year. Medicare pays 80%, you pay 20%. So after reaching the Part B deductible, $257 a year. So I'm setting everything up to kind of show you how things would be with a supplement or how they would be with Medicare Advantage. So I don't mean I'm setting you up, I mean the slides are transitioning in that way, okay? So average out-of-pocket cost, Part B premiums, $185, other premiums, $0, let's say inpatient, $38, outpatient prescription drug plan, $328, dental services, $42, and other healthcare services, anything else that's covered under there your grand total would be $704 out of pocket. So let's talk about how Medicare supplements help cover original Medicare costs. So I'm going to say that one more time. So we're going to talk about how Medicare supplements helps cover other Medicare costs. So what is a Medicare supplement? So unlike original Medicare, a Medicare supplement plan is offered through private insurance companies. So because it's offered through a private insurance company, now it's important to understand the initial enrollment period, because in the initial enrollment period, you can get in without having, it's guaranteed issue, so without having medical exams and all of that. After that, then there's potential medical exams and you could potentially be denied. The other thing about these companies is they can change from year to year. I talked to a few of you that said that you have some changes in your current plan, right? That's what they are allowed to do because they're not government, it's not the same. So insurance companies are required to offer the same basic benefits for each lettered plan, though they do not have the ability to charge different premiums, okay? But their control is they can actually decide, you know, to go up on it, or they can also decide to not have you on there. Also called Medigap, these plans help cover the gaps in original Medicare. That's co-payments, co-insurance, as well as yearly deductibles. So I'm apologize in advance for this. I've actually looked at this slide from the back and it's pretty tiny. But what I want you to get from this, if you look at all of these Medigap plans, that's A through N, that's confusing, isn't it? A through N. They all offer different little things here. Like for instance, Part B hospital co-insurance, Part B co-insurance or copay, blood first 3 pints, Part A hospice co-insurance, right? That is Medigap benefit A. But then if we look down, what they don't offer is the Part A deductible, Part B deductible, Part B excess charge, international travel or emergency care. So all of these are different. So we go through A through N, but I'm going to tell you, I'm going to let you in on a little secret. The ones we mostly write are these two right here, Plan G. Now, depending on your situation, these will probably give you the best value, okay? So here's what the bottom line is. You can select from 10 different Medigap plans. Each plan covers a different combination of Medicare costs that you typically pay out of pocket. Remember, it's called a gap. So there's a little gap in your coverage, meaning that you would be actually responsible for that. Now, Medicare or this Medigap plan would actually fill that gap. Does that make sense? So these plans are standardized no matter where you live, what company you select, but the price can vary, okay? Medigap companies evaluate your coverage application based on your health, sex, and age. If your health declines, you could be charged a higher rate or even denied coverage, right? Remember I said that? The only thing is when you're doing an initial enrollment, that doesn't happen. It's guaranteed issue. So if you purchase a Medigap plan during your initial enrollment, you're guaranteed to get a plan at that company's best rates. So I gotta help myself with that. So now let's look at Medicare Plan G. So as we look at Medicare Plan G, you notice these little red marks right here? Okay, so remember a few slides back, although they didn't have any red marks and you would have to pay for that, you were responsible for that. With Medicare Plan G, and this is just an example of one plan, the Part A deductible goes away. So there's nothing to pay up to 60 days in the hospital, so that hospital stay is nothing all the way through, because on day 61, when you would have been paying $419 a day, that's covered. Day 91 to 150, that's covered as well. And moving over to the skilled nursing copays, day 1 through 20, nothing. Day 21 through 100, that $209.50 goes away, okay? And then over here with your Part B costs, so that 185 to 628, you still have that. Now, and that's based on the MAGI. And then you have the $257 a year deductible. But remember, you were paying 20%. Now you don't pay that 20%. You don't have to pay that. So this is after reaching the Part B deductible of $628.90 a year. So you see there's a benefit to having the supplements and some of these other coverages as well as Medicare Advantage. Is everybody okay as far as the temperature?
Yeah.
Okay, all right, yes, no, yes.
Yes.
Okay, all right. It's warmer though, right?
And it's
Yeah.
warm.
Okay, I'm hot. So that's just me. That's me.
Take your jacket off.
Take my jacket off?
Yeah.
Okay, y'all forgive me for not looking professional.
Take your jacket off.
Okay.
I wish I had a blanket.
Okay. And I am pausing a little bit because I am allowing the translator to catch up with me. So that's why I'm pausing instead of just flowing right on through like I normally would. Okay, so let's talk about Part D. Has anybody heard of Medicare Part D?
Yeah.
Okay, prescription drug plan. So it's optional, a drug benefit that's intended to help Medicare beneficiaries reduce their out-of-pocket costs. So it's a federally enacted program, but it's administered by private insurance companies. Once again, private insurance companies. Part D is a prescription drug coverage, and the plans are required by federal law to offer the basic benefits offered by Medicare. So when we look down here, I put a little note here. If you decide to delay taking Part D, you may incur a late enrollment penalty. Now, I talked to one or two of you that's working still, and let me say this about working. You don't necessarily have to take the coverage if you're still working. Here's the caveat. It has to be what they consider creditable coverage. What that means is, specifically, if you're working at a job and it's less than 24 people, that is not considered creditable coverage, and you would want to get into a plan during your enrollment period. Medicare Part D prescription drug coverage. You usually choose Part D in one of two ways. So a standalone insurance plan to cover those prescription drugs, and as a part of a Medicare Advantage plan. So it's Medicare Advantage plus Part D. Now, there has been some changes in coverage. This is part of the 2025 changes that had everybody kind of calling up saying, hey, looks like my plan is gonna change, you know, can you come review it, that type of thing. And there were some changes, there were some cuts, right? Because when the insurance company is getting less money, they have to pass it along to who? The consumer, right? So with this specifically, Medicare Part D is changing 2025 to make prescription drugs more affordable. Yay, right? That's good. So out-of-pocket spending cap. So who remembers the donut hole? Anybody ever heard of the donut hole?
Yeah.
It's not as good as it sounds. So that whole donut hole was really, it was a mess, to be honest with you. You go along and you'll be paying, you know what your amount that you're paying for your drugs, and all of a sudden it just skyrockets out of nowhere. That's the donut hole, okay? So that's going away. So the cap on out-of-pocket spending is covered, for covered drugs is $2,000. So once you once you reach this amount, you'll automatically qualify for catastrophic coverage and won't have to pay out of pocket for covered drugs for the rest of the year. I think that's a win. So the benefit phases, Part D benefit will have 3 phases. That's the deductible, initial coverage, and catastrophic phase. In 2025, the deductible will be $590. During the initial coverage phase, you'll pay 25% of your drug costs until you reach the $2,000 out-of-pocket limit. So that, and there's a coverage discount program. Well, that program will be replaced by the manufacturer discount program. The prescription payment plan, Prescription D sponsors will offer a plan that allows enrollees to pay their out-of-pocket prescription drug costs in monthly payments instead of all at once. So cost sharing will continue to be capped at $35 for covered insulins and $0 for Part D recommended adult vaccines. So right now, that's what that is. That's what happened. That's what we're going under. As you know, we got a new administration, and we're undergoing some other changes. It's kind of like under construction. So right now, that is what it is. What it's going to be like, next month, not quite sure. Okay. So let's talk about some numbers, do a quick little case study. So a 65-year-old male with a Plan G coverage. Plan G covers all expenses except the Part B deductible, Part A deductible, Part B co-payments, 20% of the billed Medicare amount, Part B excess charges up to 15% of the billed Medicare amount, hospital and skilled nursing stays and co-payments. So total out-of-pocket would be $268.50 versus an average of $655 a month. So it helps to avoid unexpected expenses. So let's talk about how Medicare Advantage helps cover original Medicare costs. So what is Medicare Advantage plan? So unlike original Medicare, Medicare Advantage plans is offered through private insurance companies. So the benefits from the Medicare Advantage plan vary in several ways. Although many plans have a low or zero monthly premium, you're responsible for several costs. So anybody other than me see a lot of commercials that talk about low to no premium? Well, that's true. It could be low to no premium. So with Medicare Advantage plan, you might be responsible for co-payments and co-insurance, yearly deductibles of out-of-pocket costs, staying inside a network of doctors and hospitals, okay? And we know a lot, depending on whether or not you get an HMO or you get a PPO. So if you get an HMO, yes, you're gonna stay within that network of doctors, and you may be able to go somewhere for a specialist, but they're very tight on who you can go to. You get a PPO, you can go pretty much who you'd like to. So Medicare Advantage, option 2, and as we look at this particular plan, again, I talked about Part C here, which combines A and Part B into one plan. Then you have Part D, which is usually the prescription drug coverage and may offer traditional benefits not in original Medicare. And I want to say this, so I don't necessarily represent any one or the other, and I'm trying to be balanced and fair-handed the way I explain this, because really it depends on your individual situation. So if you want to know more about it, let's make an appointment. So Medicare Supplement versus Medicare Advantage. All right, so what I'm going to discuss here is specifically this. So your monthly premium with the supplement plan, yes. Okay, can I appeal the coverage decisions to Medicare with Medicare Supplement? Yes. Medicare Advantage? No. You might be able to write a letter to the company, but there is no appeal. If they say that this isn't covered or that's out, then that's it. Can my plan drop my doctor? With Medicare Supplement plan, no. But with Medicare Advantage, yes, they can drop your doctor. Your doctor, they can either drop him for a lot of different reasons. To be honest, most of them are financial. Can my plan be canceled? With Medicare Supplement, no. With Medicare Advantage, yes. Again, remember, Medicare Advantages are private insurance companies. And at the end of the day, they're a business. So because they're a business, usually the business does what's best for the business, right? And its shareholders. And then the ability to travel the country and use any doctor and hospital, Medicare Supplement plan, yes, you can do that. Medicare Advantage, no. Remember, you're gonna have to stay in a network of doctors. So let's talk about choosing, well, how we're gonna choose what's right for you. One, let's talk about who's eligible. At age 65, you're eligible for Part A and Part B, even if you still work. You may be eligible for Medicare through your spouse, although you still must qualify by age and disability. You may also qualify for Medicare Parts A and B if you're 65 and have a disability. So if you receive the Social Security benefits, there's an automatic enrollment, and you probably already have your card if you receive the Social Security benefits, or railroad retirement benefits. The initial enrollment period is mailed 3 months before turning 65. 3 months before turning 65. So who is 3 months to turning 65 within that? Okay, all right, good. So what I suggest is that you get on the front 3 months as opposed to the back 3 months that they allow you after your birthday, okay? Because anything can happen. And then if you don't sign up, then you end up with a penalty.
I'm sorry, quick question.
Yes.
So the enrollment period is actually 3 months prior to the 65th birthday?
Yes.
If it's after, then that's when the pre-existing start being reviewed, or you could be at.
Actually, so if we look at it as a window, it's 3 months before and it's 3 months after. So what I'm saying is, do the 3 months before. In my opinion, of course, it's all up to you, but do the 3 months before as opposed to 3 months after. So in the 3 months prior to turning 65, that's the initial enrollment period. So Medicare initial enrollment period in the 3 months prior to turning 65, the month in which you turn 65, in the 3 months after turning 65. So if you retire at age 65, the enrollment depends on when your employer sponsors coverage ends, okay? And the newly qualified due to disability as well. So your Medicare supplement enrollment periods, let's talk about that. You got your open enrollment period. Starts the month of your Medicare Part B is effective, and the date lasts for 6 months. So your guaranteed issue regardless of health status. Then you have your special enrollment period. This is guaranteed issue right or another qualifying circumstance. So we live in, she just accidentally hit the thing. Sorry. I say that because I saw it. You didn't see that. So the special enrollment period, let me give you an example of the special enrollment period. We live in Florida, right? Anybody remember the last hurricane we had? Okay, well guess what? The government allows there to be a special enrollment period. True story. Yeah. And there's others, and we don't know when they're gonna say, okay, it's a special enrollment period, but usually natural disasters, specifically hurricanes here in Florida, we have special enrollment periods all the time. So then you have your outside enrollment period. Now, if you get enrolled outside the enrollment period, you must pass medical underwriting. There's no guarantee issue from the insurance company, also known as you can be declined. And here are a few important dates here. October 15th to December 7th, annual election period for Medicare Advantage plans and prescription drug plan, which is Part D, for the next calendar year, effective January 1st. Then January 1st to March 31st, the annual disenrollment period if choosing to return to original Medicare. So here's what happens. You'll eventually, first of all, let me ask you a question. I'm asking a lot of questions. Who's getting a lot of phone calls? Everybody getting a lot of phone calls? No? Okay.
Yeah, we're thinking about.
They're not calling you?
No.
Oh, y'all need to talk to her to figure out how they get.
I'm a special circumstance. I'm already disability since 2010.
Oh, okay.
Oh, fine.
Okay, all right.
So
they left
my
you out.
circumstances are a whole, this is like, wow.
Okay.
Yeah.
So, well, right now, you're probably more popular than you've ever been, like even in high school, maybe. You know, very popular. Everybody wants to talk to you and invite you out to dinners and different things like that. But what you have to be careful of is those people who get you on the phone. Now, I'm gonna tell you one trick. I don't use it. It's not mine. I'm just telling you because it happened to my dad. So they'll get you on the phone and they'll try and switch you, okay? But the way they're supposed to contact you is you have to call them. So if you call them, then they can go ahead and start having a conversation. If they call you, there's something that they have to do. There's a 48-hour waiting period that they're supposed to have where they send you prior to the meeting a scope of appointment. That scope of appointment says exactly what you're supposed to be discussing. So if someone calls you on the phone and they say, hey, yeah, I want to see if you want to go over your benefits. Ask them this. Do you have a scope of appointment? When are you planning on sending me that scope of appointment? And don't give them your Medicare number, okay? If you give some of these people are unscrupulous, and if you give them their Medicare number, you're as good as changed. So what I say is, you want somebody that you can kind of put your hands on, you can talk to, that gave you a magazine, so it has a number on there where you can call them and they can come out and talk to you about it. Even if you just have questions, like, hey, so is it true what they said online, or is it true what they said on TV that this is low or no cost? Can you look at that? Sure, I can look at that. And all I do is sit down, I put in your zip code, and I can pull up every single plan that's offered in your area. So there's nothing special that they're able to do that someone who's local can't do. Okay, ran over. So January 1st to March 31st, annual disenrollment period. Now, why do we have an annual disenrollment period? Who knows that? Because somebody answered their phone and they got enrolled in something with somebody over the phone that's in Wisconsin, and now they figured out, oh, this doesn't cover my doctor, this doesn't cover my meds, And they want to call them back, but they can't call them back because they're in Wisconsin, right? So that's why this part here is here. The government added that so that we can fix those things, okay? We are in the home stretch, ladies and gentlemen. Other helpful resources available at www.medicare.gov, which, by the way, is where I got all the information for the slides. You probably have this wonderful book that you probably already read. It's about this thick that says 2025, your Medicare, right? So handbook. So you can go back and check that handbook and see if I was right. The other thing is Medicare and You Handbook, published by the Centers of Medicare and Medicaid Services, and that was released each fall. And then Choosing Medigap Policy, a guide to health insurance for people with Medicare, a publication developed jointly with CMS and the National Association of Insurance. All right, so here's some other things that you should consider. Estate planning and wills and trusts, 401k rollovers, hospital indemnity plans. And let me say this about hospital indemnity plans. If you've ever gone to the hospital and you stayed a certain number of days and then they give you a check once you get out, that's the crux of a hospital indemnity plan. Tax mitigation and wealth transfer, cancer, heart attack, and stroke plans. That's something that Kim and I have. So if we, God forbid, have a heart attack or a stroke or get cancer, then we also have $25,000 to $35,000 that's coming to us. Final expenses, Social Security income protection, and standalone dental, vision, and hearing. Now you heard that some of these plans already have dental, vision, and hearing in the plan, right? But it's always good to kind of have your own plan too. Because if, let's say, you know, one of your tooth falls out, and now you want to get something instead of denture, you want to go ahead and get an implant. You know, you may not have enough coverage without coming out of pocket with the plans that I just mentioned. So that's an option too, to have your own. And here are some of the other companies that we represent. Aetna, Humana, United Healthcare, Florida Blue, Devoted, and Cigna. And here's some others: Mutual Omaha, F&G, Transamerica, Forces Financial, Nationwide, and Aflac. And so I'm gonna say why choose us? Here's why. So number one, as an independent agent, we work for you, not the insurance company. I'm not beholden to any insurance company. I'm an independent broker. We hold no bias to any insurance company. We shop all the available Medicare and prescription drug plans in the state. We don't charge any fees for our services. The insurance company pays for our services. We're experienced agents. Now, these two right here are not agents. So that's my daughter, Jasmine. She's 21. I tried to ask her if she wanted to go into business. She said no way. And this is Michael. So Jasmine is actually in school in San Diego, and she is studying jewelry design. I'm super proud of her. But she didn't want to do insurance. I told her it's a good job, but she didn't believe it. And then Michael also, you know, told me no, but he is an HVAC repairman now, so I'm happy with that. You know, I'm okay. So that leaves Kim and I, and we're doing insurance. We're doing insurance. So we're trying to keep everything going, and we love what we do, and we know that we provide a service. So if you would please, Kim is going to come around here shortly with a permission to contact. Thank you very much. You're free to go get your dinner. I hope it's good. I saw a lot of fried chicken out there. Don't eat too much fried chicken. There's some baked stuff out there too. Thank you so much. I appreciate it.
Thank you. Well, this program is
You did a good job.
interfere with my medical insurance.
Which program?
What you're offering here, or
So,
Come back.
Y'all said you need to come back in so they can count it, so we can make sure. Yes, ma'am.
I want to say hi, go back, Kevin.
I can schedule what you want, your dates. I'm gonna come in just a second. Okay. Get my phone.
I'm gonna read this to you.
I need a
Yeah, you turn the light.
Can you turn?
Yeah, I'm
Some of it.
Mayor,